Rpe from Next Gen Rehabilitation, and in today's video I'm going to be talking to you about exercise prescription, more specifically exercise intensity, how hard you should be working out if you're a cardiovascular patient, but this does also apply to individuals who have diabetes and metabolic disease and just training in general. So basically the biggest question coming out of heart surgery, having a stent put in, how hard am I allowed to push myself? How much exercise am I allowed to do that's safe and efficient for me? And primarily, the first thing I'd want an individual to do is obviously get clearance from their physician. Make sure you're okay to exercise. There are certain situations where there should be a little bit more of a recovery period before you do any type of increased exertion. So always check in with your doctor and be like, is it okay if I start a little bit of a walking program? Light walking, moderate walking, that sort of stuff, and see what they say. And if you are clear to start doing some sort of exercising, the best way to gauge it, especially aerobic exercise, is what I like calling the talk test. Okay, so when I prescribe exercises to my patients, I talk about two things: the talk test and the rating of perceived exertion. So I'll talk about the Rpe scale first. The Rpe scale basically is a self-perceived scale of exertion. How hard does the exercise feel for you? So when I'm training my clients, we go through a 3-point exercise continuum. We have a warm-up stage, exercise stage, and a cool-down stage. So in a warm-up stage, that stage is necessary in order to get the body going, get the joints lubricated, slowly increase that heart rate, because we don't want to start, especially after surgery, a place where we're not doing anything and just bumping it up to maximum. That's just going to put too much strain on the heart. So we want to make sure we have a proper warm-up, which should last anywhere from 7 up to 10, even some individuals do 15 minutes, which I'm pretty happy with, because we want to sufficiently warm the body up. If you're someone that has arrhythmias, or if you're someone that has had a heart transplant, if you're someone that just generally is more deconditioned, then a longer warm-up in that 12 to 15 minute range will definitely facilitate better results for you. But bare minimum you should be doing is at least 7 to 10 minutes. So when you do your warm-up, intensity-wise, it should be very light. You should be able to maintain it, no problem. The way I like telling people is, are they able to sing when they're doing their warm-up? If you can sing, you're in good shape. The next stage, our cardio stage, or exercise phase, this is the bulk where we're actually able to stress the heart and push a little bit. This stage lasts anywhere between 30, 45, and even 60 minutes, depending on the individual. If you're someone that's a little bit weaker, we're going to go on the lower end. We might even break it down to 15 to 20 minutes and break it up into smaller chunks, maybe 5-minute intervals, or maybe up to 10 minutes, take a break, 10 minutes, take a break, or maybe 5 minutes, take a break, 5 minutes, take another break. So it really depends on the individual, and that's why if you are someone that has any sort of heart issue or metabolic disease, diabetes, that sort of thing, it's always nice to work with someone that can give you some education as well while you're exercising. Look at you, how are you feeling physically, are you symptomatic, is this exercise tolerable for you? But ideally, intensity wise, how I like prescribing it to my patients is moderate. Okay, so when you're exercising, yeah, you're going to be breathing a little bit heavier, yeah, you're going to be sweating a little bit, and it's going to be a little bit challenging, but it's only a moderate. It's not hard. How should that feel for you? You should be able to do the talk test. Can you still carry out a conversation when you're exercising, and are you symptom free? Okay, so when you're exercising, what I like getting my patients to do periodically, 5 minutes into their 10-minute segment, is talk to the person beside you, talk to your spouse, talk to whoever, maybe it might even be with no one, so you can just talk with yourself. But basically, this is just allowing us to see, is your body getting adequate amount of oxygen throughout the body in order for you to A, still carry out a conversation, and B, not feel any symptoms when you're exercising. So as long as you're in that moderate range, you're in good shape. Now, if you start getting to the point where you can't hold a conversation anymore, it's probably a little bit too difficult for you. And what I'd recommend at that point is either lower the intensity on the machine you're using, lower the speed on the treadmill, lower the level on the bike, or walk at a slower pace than you're walking right now. All right, and then the last stage is the cool down stage, and again, we have our heart rate way up here. We don't just want to stop, because again, if we go from way up here and just stop, a little bit stressful on the heart. We need to have that gradual continuum to slowly bring it back down, and then once it's back down to our resting, or close to resting, then we can go on with our day-to-day. And the cool down should last at least 10 to 15 minutes. And in our cool down stage, this is where we do our stretching exercises and we do our breathing exercises. Okay, so again, with cool down, it should be very light, not really any hard intensity at all. You should be able to sing when you're doing your cool down to know that it's a perfect gauge, perfect intensity for you. And if you follow these guidelines, it should allow you to work within a comfortable range. Now, again, there should be no kind of filler for a prescription that you've already been given. If you are someone going through heart disease, diabetes, metabolic disease, again, always checking in with your physician, see if you do need to be monitored. But they're very general, basic guidelines to follow. So again, with a warm up and the cool down, we should be able to sing. It should be a light intensity, and with the with the exercise phase, that actual phase where we're exerting a little bit harder, it should be a moderate, or we should be able to carry out a conversation when we're doing exercise. Now, if we can't carry out a conversation, it's probably a little bit too hard for us. We need to slow our pace. There are other ways that we do measure exercise intensity. Heart rate range, MET value are a couple other ways, and I can go into those a little bit more in other videos. But again, for each individual, it's going to be different. Some individuals don't reach their true heart rate max when they do their treadmill test because either their legs give out because they're too fatigued, if they have knee issues. Some of the medications prevent individuals from really stressing themselves to the fullest point. So again, heart rate range is a good measure, but we don't always get the results we want, and that's why I like going off the Rpe and the talk test. So again, I hope that video helps, and we will see you in the next one. Comment below, share if you did find this video useful, and definitely let me know if you want to see what other content you'd want to see on the channel. Have a good day.